Hello everyone. A very good morning from Bangladesh. I'm Juwel Rana. Today in this 32nd ISEE 2020 annual conference, I'm going to present our research on joint effects of blood level arsenic, lead and selenium on blood pressure outcomes in a Bangladeshi cohort, a generalized weighted quantile sum approach. Currently, I'm working in the Department of Public Health, North South University, Bangladesh, Department of Biostatistics, Epidemiology, University of Massachusetts, Amherst, and South Asia Institute for Social Transformation in Bangladesh. My colleague, Syed from University of Chicago Research Center, Bangladesh. My supervisor, Youssef from University of Massachusetts. Another supervisor, Honorable Professor Habibul from the Institute for Population and Precision Health, University of Chicago, United States. Here is a brief outline of our presentation. We'll talk a bit about background, materials and methods used in this study, key findings of the study, discussion, the strength and weakness, conclusion and further research agenda. Research gap and objective. We know that every day we are exposed to multiple chemical exposure or environmental pollutants, including heavy metals. And the ubiquitous exposure to heavy metals is quite common in lower middle income countries, including in Bangladesh. Previous studies have tried to examine the effects of heavy metals and micronutrients on blood pressure outcome, and most of them have inconclusive results. Additionally, we have lack of prospective data to establish the effect of metals on blood pressure outcome. And most of the previous studies were limited to single metal effects on blood pressure outcome using traditional or conventional statistical approaches, because we lack of novel and innovative statistical approaches to assess the effects of these multiple correlated metal mixtures on health outcomes. As a result, previous research provided misleading results due to methodological issues such as high dimensionality of correlated data, multiple testing, multicollinearity, and modeling misspecification. Therefore, our study aimed to examine longitudinal joint effects of blood level arsenic, lead, and selenium on blood and pulse pressure trajectories and the extent to which these effects varied by gender in a prospective cohort of Bangladeshi adults. Materials and methods have been used. The study population were from Bangladesh vitamin E and selenium trial BEST. It's a 2x2 factorial randomized controlled trial of 7,000 adult permanent residents from Araihaja, Naranganj and Matlab Chatpur district. It's a rural settings, and the respondents have manifest arsenical skin lesions. They were randomized between April 2006 and August 2009. And we did a biennial follow-up for 6 years period. Biomarkers of exposures were measured, blood concentration of arsenic, lead, and selenium at the baseline only. We have huge number of missing for lead because we are not able to examine this biomarker for all of the respondents due to financial issues. And blood pressure outcome were measured at baseline as well as in 2-year, 4-year, and 6-year follow-up by our trained physicians. The covariates and data related to covariates such as age of the respondent, gender, body mass index, years of education, occupation, cigarette smoking, and ownership of land as a proxy of socioeconomic status were included or collected. Analytical framework was generalized weighted quantile sum method, one of the multi-pollutant or mixture analysis technique. It uses empirically weighted sums of quantiles. We use deciles, that means 10 quantiles, and our training and validation data were 40% by 60%. We use 100 bootstraps with quadratic and without quadratic terms. We observe or assess both positive and negative directionality of metal mixtures. We use our package, GWQS and MIS. MIS for multiple imputation for lead data. Why we use GWQS? Because it helps to reduce the effect of high dimensionality and collinearity on the result. Quantiles minimize outlier effect. Nonlinear programming and bootstrapping are possible, and the developer of this method claim that it has higher specificity and better sensitivity. Here is a conceptual framework we have used: blood level metals, lead, selenium, arsenic. We develop weighted quantile sum index from these metal mixtures. We adjusted these covariates: age, gender, years of education, occupation, smoking, ownership of land. We did not include body mass index in the analyze, or we did not adjust, because this is one of the intermediary variable mentioned by previous studies that it might have mediating role in the association between mixtures and blood pressure outcome. And we also see the stratified effect. Here is the baseline characteristics of our study population. You see the age where the mean age 42 years old, and majority of the respondents were between 25 to 37 years old, and 60% respondents were female. More than 50% respondents had overweight and obesity. 42% people did not have any formal education. In terms of occupation, we can see most of the respondents, at about 57%, were homemaker, because female were basically not involved any formal job. They are doing household worker. And 52% household had, or respondent had, ownership of land, which is important in the rural context. We found that only 20.3% respondents were currently smoking. Here is the mixtures and blood pressure outcomes. We use follow-up 3 as the outcome of our research, or for this for the purpose of this research, and we adjusted for baseline blood pressure outcome. In terms of metal, if you see the metal concentration in overall population, we mentioned in IQR it's 27.7, UGTL, selenium 32, and for lead it was 99. And for blood pressure at the third follow-up, we measured it mmHg. You know that for systolic it was 1118 with a 20 standard deviation. For diastolic 77. For pulse pressure it's 41. So pulse pressure were calculated with the difference between systolic and diastolic pressure. And from this descriptive statistics, we see that blood pressure were normal for this population, even at the third follow-up. Now we see the correlation among exposures or mixtures, and we see negative correlation with lead and arsenic, between lead and arsenic, and it's not as strong. Even they are not strongly correlated, they are moderately correlated, I'd say. Some may argue it's weakly correlated or weak correlation. There is a model we have developed with imputed data for lead and also other missing values, and we have also developed model with complete cases. It was 9,900 with complete. So in this model, like complete model with imputation, we found that weighted quantile sum index were positively associated with blood pressure outcome, like all three outcomes, systolic and diastolic and pulse pressure, and lead were the prominent uh, metal among these three mixtures. So we also observed we also tested the negative directionality, and we found also significant inverse association between mixture and blood pressure outcome. And here arsenic was significant one or prominent one. We can say that the reason could be the respondent or the population we included, they are highly exposed to arsenic. So that might be the reason that we see here inverse association with weighted quantile some index of mixtures and blood pressure outcome. And for all these models, we adjusted for baseline blood pressure, gender, age, years of education, occupation, cigarette smoking, ownership of land. And we said for the purpose of sensitivity or verification, we also developed with complete cases, but we didn't find exactly identical result. That could be due to the really lower number of sample size. For lead, it was only 900. Discussion and conclusion. We can argue that metal mixtures has both negative and positive effect on blood pressure outcome, and according to our research, lead may increase blood pressure as well as risk of cardiovascular disease, which is like convergent with previous resources. Arsenic and selenium have contradictory effects on blood pressure outcome, which is also similar to some previous studies. And we did not observe any significant differences of metal mixtures effect by gender. And data without imputation of missing values in lead provided contradictory results. We said it might be due to the small number, and this imputation improved the result, or we'll say improve the result of this study with a huge number of sample. Limitations and for further research. It has limitation because blood concentration of metal were measured only at the baseline, and blood may not be gold standard sometimes for this exposure measurement. And we did not collect any dietary data, direct dietary information, so that might have an impact. And WQS cannot consider time varying confounders. We lost some information due to quantiles and non-zero weights and threshold choice problem in this method, and WQS don't provide any independent effect, and we need to include interaction term, otherwise it doesn't provide. And this result may not be generalizable for normal population because it's on the highly exposed arsenic exposed people. Further research could apply multiple pollutant methods such as PKMRG computation with super-learner technique. We can also check, or further research can check, the mediating role of body mass index in this association, and further research can follow the changes of concentration of metals, and further research should consider direct dietary information. I acknowledge Bangladesh vitamin E and selenium trial based, which is sponsored by the University of Chicago and other collaborators of this trial, Columbia University, Dartmouth, ICDTRB, University of Chicago Research, Bangladesh. And a special thanks goes to my friend Stephanie Ranjite, who developed the R package for WQS, and I got lots of help from this guy. And with this, I will thank you all to watch this pre-recorded session, and particularly this symposium. Thank you so much.